Hello, good afternoon. My name is Dr. Robert Sech-Toleko. I'm a biomedical engineer, and I work in various hospitals across Uganda, building capacity in biomedical engineering, as well as lecturing at Makerere University.
You've talked of biomedical engineering. Could you please explain to us what it's all about?
Biomedical engineering is a field which is relatively new across the world, but some countries have actually embraced it for about 50 years. Whereas here in Uganda, we've just started actually building capacity in that field. And this is a field which actually trains and empowers people to look after medical equipment. So to a local person out there, medical equipment is what you need when you go to a hospital for a doctor to look at you and know what problems you have. And also, it can be used to actually treat you. For example, you've heard of pregnant women going to hospitals, and the doctor wants to see how well a baby is doing. They'll go to what they call an ultrasound machine. If they want to know your blood pressure, they will use what they call a blood pressure machine, which they tie around your hand to know what is actually happening. And for those machines used for treating, we have like linear accelerators, which are very sophisticated machines. And one of the machines we have here in Uganda is the Cobalt 60 machine, which is used to treat cancer, which has been controversial in the news. We do have actually quite a number of machines around here. For example, for very sick patients, they need to have infusions of different drugs into their systems, controlled very, very accurately. And so, for example, we have these infusion devices where they attach drugs and they can be infused into patients. This machine here is called a diathermy machine. And that machine is actually used to do surgery. Instead of using a knife, they actually use electricity to cut or to stop you from bleeding during surgery.
Okay. Yeah. So you've talked of this being a new course in
How long this field has been in Uganda is really very difficult to say, but I know that higher institutions of learning have only just started training in this field. For example, Chambogo University started training diploma students. I think it was around 2010. And Makerere University then started training bachelor students. And so far they've got 2 cohorts who have graduated. And Ekure also trains some biomedical diploma holders in Uganda. So it's very relatively new and not quite embraced within the hospital structures across the country. We do still have a lot to do, yes.
Is that the reason why you started like this project? What is this project about?
So because it's very new, we identified that actually there's a lot of people working in hospitals who lack the appropriate skills and the support as well as the mentorship to actually be effective biomedical engineers. And this is where the Uganda Maternal and Newborn Hub came in to start building capacity of technicians across the hospitals. So the technicians that you found us training today actually have been working in these hospitals, some for over 15 years, some have just started for less than a month, but so they've got varied experience and skills, but now we want to actually give them extra skills that are needed. And there's other programs across Uganda, so we are one of the programs that try to build capacity and hopefully build the field of biomedical engineering in the country, which is very young at the moment.
Has it been already?
People are not quite aware of this field, not just in universities, for example, institutions, yeah. And for example, there isn't really a defined cadre of biomedical engineers in hospitals in the country. We are actually lagging behind on the standards of medical equipment, so we quite get a lot of poor quality medical devices in the country, just like they get so many other poor quality devices across for home use. And because these are very crucial devices for actually use on people's lives, it would be really good to have standards as well. And it would be nice to actually get this cadre to be integrated within healthcare provision, because actually doctors really struggle a lot without the machines that actually support life or help to diagnose problems. For the students out there watching, biomedical engineering is really a science as well as an engineering. In a nutshell, it's actually combining the principles of medicine and the principles of engineering to try to enhance life, to try to make people have a good quality of life. And the field is very, very varied. People do go and specialize in so many different things, and so they can specialize in imaging equipment such as X-rays, CT scanners, MRIs, ultrasound. The list is huge. And for a student who wants to come on to do this course, you need a strong physics, mathematics background, as well as good biology understanding, because that's what we are trying to combine. Yes.
What is that thing that you think the students should, what is that?
Inspire students is actually what is actually what inspired me. So what inspires me is to know that I'm going to be supporting life. I'm going to actually improving life. I love researching into actually new technologies that have never been discovered, and they are going to actually enhance the way healthcare provision is done. For example, there are so many researchers in HIV treatment, and they've tried drugs, they've tried so many different things. Where biomedical engineers can come in is actually to help have early diagnosis of HIV, for example, because it's been known that actually the moment you, for clinicians in hospitals, if they get HIV, they can go on tablets which are very strong, but for 30 days, and then can actually, they reduce a chance of getting HIV. But the problem is there's no very early diagnosis of this. So you can see how, if you are driven by such things, you can actually come in and say, well, I'm going to come in as an engineer and develop a device that will detect HIV like within hours of someone contracting it.
Okay. Yeah. And how better is it going to contribute to the health sector?
How better is it going to contribute to the health sector? Basically, the contribution is huge. I honestly couldn't start even explaining. For example, we do have volunteers who were even brought in from the UK for this program training, and they will probably share their experience where in every department in a hospital in the UK, you have a biomedical engineer who's responsible for that equipment. So it means that at least if the biomedical engineers are trained well, are supported well by the government and all the support structures such as procurement, accounting, management, administration, it means that our devices will be working very well. It means that I'm sure you've had so many stories where people come into a hospital and they say, we would operate, but this machine is not working. They refer you somewhere. And they can only refer you to so many places until you run out of life. Life actually cannot be gotten back. So we are the guys behind the scenes to make sure that actually these machines will be working at the most critical point when people need to be diagnosed or when people need to be treated. So our contribution to the healthcare sector is huge, and I hope it's high time everyone recognize that.
Okay. Now you talked of machine substitution, and how should it be addressed?
In my opinion, the challenges with our field, they are systematic basically. It's not just one standalone challenge. For example, if you ask most of my colleagues across the country, they will tell you we lack spares. Yeah? We get equipment that are donated, which actually lack parts and they cannot be used. We get donated very old equipment, which are obsolete, and the manufacturers or suppliers will not support. And when we can combine all these together and say, we need to, actually our challenges is the whole system. So for example, if we lack spares, that's down to really the standards of actually looking after this equipment. If the standard says you should actually replace a part of this machine every 6 months, then of course people will ensure that those parts are there. If, for example, the standards, regulators say that you shouldn't donate equipment that don't have some parts, then the donations will be very much improved. And also challenges of actually getting the field to be financed, so that not only that we can actually work on the machines, but we can actually research into the problems ourselves. At the moment, we don't really have any publications or reference documents on what other technicians should base their doings in Uganda. And we know that some of these problems are varied. You can't always borrow examples from another country because some of these problems are unique to our country.
Okay. Yeah. Now, are you working hand in hand with maybe Ministry of Health or any government entity?
Yes. So our project, the Uganda Maternal and Newborn Hub, actually is supported by the Ministry of Health. We've been there through the Uganda and UK Healthcare Alliance, and actually they help us because most of us working with this project, we are UK who are volunteering onto the program, and the only way we can get access is if the ministry actually grants us permission and says that they want to work with us. And also we are working with an association for medical and hospital engineers called UNAME, Uganda National Association for Medical and Hospital Engineers. And we are trying to see that actually they embrace this change that we are trying to bring and say that we can work together and they can work as mentors as well as provide other benefits to especially the youngsters who are graduating or those who are going to jump into the training. The ministry, yes, we are working together. We would want to see them working with us closer, so maybe be involved in the monitoring and evaluation to some extent, maybe also coming and take some of our results to actually use as evidence to better the field, which is very young, and so many other things.
Okay, is that the whole that you're doing enough yet?
I know the government is very, very busy. I know they have so many priorities. If I was asked to give one particular thing I want them to do for biomedical engineering field, is actually to have a roundtable discussion, and they actually create a cadre of biomedical engineers within the system. Not just in hospitals, we have the Uganda National Bureau of Standards, we have so many other regulation bodies which actually where our knowledge would be of very, very huge benefit to the healthcare provision of the nation.
Okay. Yeah. Could you please encourage any student out there who is watching to do biomedical engineering, those who are joining the university?
So for any potential students, what I say is I'm very passionate about this field. I'm so passionate because I studied it at undergraduate level and I went on and pursued a PhD in the field. I know that we need to be more of us to actually be able to build this field. At the moment, there's very, very, very few of us who are trying to do this thing. So the students should really gain passion. And if it's jobs that we are worried about, then yeah, we are working onto that. I'm employed and so many of my other colleagues are employed. And so there will be jobs. But above all, we should care about actually bettering healthcare provision through the field of biomedical engineering. Thank you very much. And I want to thank also Chambogo University. They've always been very good supporters of our program, and that's why we are here in Chambogo, especially to Dr. John Okonzi, who's actually here in the room with me. He's been very, very instrumental in supporting and helping to work together to build this, as well as all my colleagues in the hospitals. I could spend the whole day thanking everyone here. Yes. Anything else? I would really want to thank all those who are committed to building this field, starting from the people up and down to the students. And I want to thank especially the students or the just currently graduated students. They know the field is hard, the field is very difficult, it's very challenging, but they have so much passion to actually see that this field is built. They really believe in what we believe in as well, who have been in the field a little bit longer. I really, really want to uphold the students for really taking this initiative. For example, you coming to actually speak with me was one of the former students of Makerere University. And the great thing is they all work together, Chambogo students, Makerere students, Ekiri, to try and build this new field up in Uganda. Yes.
Thank you so much.
Thank you very much.
Please introduce yourself.
I'm by the names of Kasami Joet Wing, an engineering technician working with Ministry of Health, based Fort Portal Regional Referral Hospital. Yeah.
What has been your experience in that profession?
My experience in being an engineer working in the hospitals is there are so many challenges within the region. We have seen most of the equipments breaking down and no quick response, which can lead to death.
But if they break down, I think it's your role as the technicians to
Yeah, when
work
I
on
came in, that was the first challenge, but we have struggled hard to work together with the government and the other implementing partners within the government to come and help.
Okay, you said you're based in Fort Portal. How is the situation there?
The situation in Fort Portal has improved rapidly, not only in Fort Portal Hospital, but in the whole region. For example, if I reflect on the inventory taking that we had, the ministry recommends that at least in the hospital, 67% of the equipments should be in good working conditions. But for example, in our region, we have 87% of all the equipments in the region in good working conditions. Yeah.
Government hospitals or
Challenges that we face in our region is possibly lack of spares. An equipment can break down, but you request for the spares which don't come in time. For example, take a look at the operating lights. All the bulbs can blow off, and without the operating lights, there is no operation which can take place. So the bureaucracies can take long to acquire those spares.
Okay. So in that sense, how have you benefited from this hub?
I have really benefited a lot. We have benefited a lot through capacity building. We have benefited, for example, like today, we have been here for the last 2 weeks, training on theater equipments. As you can see, some of them, others are not here. We have benefited through giving us volunteers in like PNFP hospitals. Those are non-government hospitals, but working not for profits. We have got some volunteers in Kisizi, Mbarara, which has really helped the load of maintenance, repair from the central workshops. From this, we have got donations of the equipments in neonatal intensive units. So many of them, I can't name them all. Yeah. I would like to encourage them to take on courage and join the course of engineering. First of all, engineering,
Overcome the fear, because some be like, man, that course is hard.
no, they should take off that fear because it is the engineering sector which does most of the things. For example, you'll be sick, but the tab that you take comes direct from the hands of the engineer who makes, and that's why I have to encourage them to come and join us in the engineering section so that we can save people's lives and be more creative.
Okay, like, how have you managed to overcome some of the challenges you mentioned?
Some of the challenges we have tried to engage in the government, giving advice on one way or the other, working hand in hand with the implementing partners, not only the hub, but we have other implementing partners like Baila, Sustain, IHA. We work together. We work together to overcome most of the challenges.
Okay. Yes. Like for instance, if a machine is to break down, how long does it take you to repair it?
It depends on the availability and accessibility of the required spares. Some machines, they need just like recalibration, which do not need spares, which you can just run in the unit, work on it, solve the problem, and the machine is put back to work.
Okay, that's why some patients end up complaining, maybe there's no this, there's no this.
Yeah, possibly.
Okay. You appeal to the government?
Pardon?
Appeal to the government?
Yeah, actually, I appeal to the government at least to put more funds in the regional workshops so that we can access most of the required materials to save people's lives in time.
Okay.
Yes.
Thank you very much.
Welcome. Thank you.
Okay. Tell us, Ms. Ella.
Okay, so my name is Ella Barden. I'm a clinical engineer and I'm currently studying to be a clinical scientist. I'm a trainee on a 3 years position, 1 year to go. In the UK, we don't call them biomedical engineers, we just call them clinical engineers. And there's this particular amount of funding that has gone into this science just because it's so important. So now what I do, I actually trained to be a clinical scientist in engineering, in device management. And to emphasize is the devices are part of the clinical procedures, and any clinical procedures cannot be done without a medical device involved.
Yes. Why did you choose that particular course? Where did the interest come from?
Well, I actually have a BA Engine, so it's a bachelor's in engineering, and then I have a master's in medical electronics and engineering, and it's very important to have women as well in this field. And basically, I think it's just because of my dad. He was an engineer himself, and I loved it since I was a young girl. Yes.
Okay. Share with us your experience when you come
To Uganda, well, it was really nice to receive a call from Arafat for biomedical engineering. He actually used to work at the hospital I'm based now, and I applied for an actual job. I sent my CV, I sent a letter, and apparently there were loads of volunteers that applied for it, and I was very happy to be called here. It's actually my first time in Africa, and I was really surprised, like so many engineers, and especially surprised that there were girls too. So not only men, which is nice. Yeah.
So what have you learned so far from this hub especially?
Well, we shared experience. I shared my experience and they shared their experience, and we've done physiology as well as electronics, which is basically what biomedical engineers do. We combine two sciences together.
Okay. How would you compare the situation here and back in the country?
Well, I think it was mentioned before, so here you actually have a really great advantage that you can learn from other countries' mistakes. So because it's the beginning of the era of bioengineering in this country, there's a lot to be learned from other countries like the UK and how things evolved in the UK, to learn from those mistakes and just improve them while implementing them here. So, challenges? Most of the people are experienced, and more of them, actually loads of people have more experience than I have. So it was basically an exchange of the views in this field.
Okay. Talk to a student who is watching right now.
To students,
Who would love to perhaps take on your course.
well, it's a field that you can study and you have loads of opportunities, national and international. You have so many companies that develop medical devices. You can go to work for the government, you can go to work for private companies, and there's loads of opportunities. It's a great field to be in. It's not all medicine. but it's not all engineering as well. It's a combination, it's a wonderful combination.
You've had hands-on experience?
I have. I've been working around 3 years now. So I've been going around in different hospitals in the UK. I'm employed by Royal Liverpool Hospital, and now I'm on a placement at Guy's and St Thomas's in London, which is basically the biggest hospital in Europe. So that's a lot of hands-on experience. In Uganda, I've been to some hospitals, but I've been here for 2 weeks only. So I've just had lectures on physiological equipment, like measurements and infusion pumps, basically. Okay, thank you.
The sound is fine. Okay, how are you?
Fine, thank you.
Please introduce yourself.
I'm Bagana Shilam Tetire. I'm a biomedical engineer currently working in Bara Regional Referral Hospital, and I graduated this year with a bachelor's degree in biomedical engineering from Makerere University.
Wow, that's interesting. And you?
My name is Arinda Beryl Ngavirano, and I'm a biomedical engineer volunteering with the Uganda Maternal and Newborn Hub. I finished my degree in May this year, and so we'll be graduating in January 2017. Wow. Yeah.
Very interesting. What does it take to be a biomedical engineer?
So basically, first of all, biomedical engineering is just integrating medicine and engineering to improve healthcare. So what it takes is basically math, physics, biology, hard work, definitely.
Science.
Yes.
Right.
Yeah.
And you?
Yeah, to become a biomedical engineer, there are different routes. There are some people who have become biomedical engineers by doing electrical engineering, and then you decide to specialize in medical equipment. Yeah, and that's a biomedical engineer. You become a biomedical engineer by doing, say, a diploma in biomedical engineering, a bachelor's in biomedical engineering. Yeah.
Why biomedical engineering? Why not any other course?
Because biomedical engineering, you directly impact life. That's the reason for me. Yeah, so with biomedical engineering, there is a sense of knowing that you can play with the technology, you know, behind the scenes, and you know that you are directly impacting the health of someone. Yeah.
Now, Sheila, maybe some...
So basically, this course is wide. It entails very many things. There are tissue engineering, there's clinical engineering, there's like biomaterials, all within biomedical engineering. So according to your passion and what you do, you choose what you want to do. So currently, like, I'm working in Bara Hospital. So what my work involves is managing the health technology within the hospital. That's making sure the equipment within the hospital are working, and not just are working, but the whole entire process of a medical device, from the time they plan to buy a medical device, it comes to the hospital, it's installed, it's repaired, it's used properly, it's serviced, and then when it gets old, it's disposed of. So taking care of the whole equipment process is also part of what I do while at the hospital. Yeah.
Now, this sounds like a male-dominated, environment. How have you managed? What has been the experience like?
From the start of maybe joining the course, that's at the bachelor's level, we were only 12 girls in a class of about 28. And yes, engineering, all kinds of engineering, is sometimes there's that mentality that it is a male kind of thing. But I've come to learn that with everything, when you put your mind to it, then, and when you have passion for it. So with that passion of engineering, I'm a girl who likes technology. So it's more of hard work and removing that mentality, because again, your mindset is what drives you and gives you, that determination. So if you get rid of that mindset and you know that with engineering, if you love it, you can do it. Yeah.
And just to add on to what Beryl has said, it's all about attitude, believing that you can do whatever you set your mind to do. And right now, the engineering field has evolved so much. So before, maybe girls were scared of carrying huge devices and different things like that. But right now, it's more of mental power. And we all have, like, you all have that capacity to do any complicated mathematics, to do any computer simulations, to do anything that you feel you can do. So biomedical engineering can be done by girls and is being done by girls and boys as well. And I would encourage more girls, if you really want to do it, if you really want to do it, then do what you want to do.
Okay. Wasn't there a point where you felt intimidated that time?
Yes, the intimidation was there, especially from the numbers. Like, you enter a class, you're 5 girls, but it's all the mind. Like, you decide, okay, it's even more chance for me to shine since we are fewer girls. So you use your situation to lift you up.
Okay.
Yeah.
And you didn't scare?
The times when it became an actual reality was when I had to do my first internship. And one of the first places we went, the engineer laughed and said, "But you're a girl. And you're even a small girl. How will you manage this equipment?" And the response I gave him was like, "That's why I'm an engineer." As an engineer, your mentality is different. If you say, "I'm too short to reach the bulb," I'm an engineer, what do? Get a chair and reach the bulb. Yeah? Or get a ladder and climb up to it. So there is always, with engineering, it's solutions to make life easy. So that means where you fail in your physical ability, get a solution that will make life easy for you. Yeah, and you'll still achieve the same goal.
I love the determination. Now, as the pioneers in this project, what has been the experience?
I hospital, and my experience has been, so what basically this project does is it empowers people who are already working in hospitals, whether they are technicians, electricians, biomedical engineers, biomedical techs, with skills, because I come from school, I did a bachelor's degree, but I don't have as many hands-on skill in many medical equipment maybe. So I get more skills, and this is one of the things that I've got through the training, knowledge exchange with various people who have been in the field for a very long time. So that experience is something, the mentorship, like all these different people mentor you, they help you through a device, through an equipment, so you don't have, so you gain confidence in management of the different devices, despite the fact that you're a fresh graduate. So also that fights the thing that, these people are new in the field, they know nothing. No, that's not the case anymore, because we have all this support that builds onto our skills, and we can attain these skills in a very short time, because we've got enough training from various trainers, people coming from all over the world, from UK. So, and we are getting test equipment, toolkits to use. So somehow we are trying to fight some of the problems that are within the biomedical engineering field here in your country.
In the project, as I've mentioned earlier, I finished in May, so I joined in June, so I've been here 3 months, yeah, and this has been my first training, yeah. So with my experience is one of the turning points or very major impacts, excuse me, I've had is with this training, yeah, that has happened for the past 2 weeks, where I've been able to interact with people who have been in the field for 15 years, 20 years, 10, 5. So it's been a very diverse category of people. And so when we're doing these trainings, they really, in the afternoons we do the sessions which have like the hands-on, and people share the experiences they actually face in the clinic. In the hospitals, someone will tell you that in our hospital, this happens like every so often, and we actually go down to addressing these issues, and you actually repair and fix. And with this, you get the confidence, yeah? Most times when you've just come out of school, you have the knowledge, you've done the internships, you've done the training, but to be left on your own to actually do this work, is a whole new phase. Coming out of school is a whole new phase. So what this training has done is to empower me to know that actually right now, if you give me this equipment that I've done in this training, I can handle and know that the patient will be safe. Yeah.
What are those subjects that someone has to major in,
Yeah.
to do biomedical engineering?
Right now, I think physics and math. I'm not really sure according to the current. They are changed every few years, but physics and math and biology. But I also think that someone who has done biology and math can do. Yeah, I'm not very conversant, but then mostly it's physics, math, and biology. Yeah, so irrespective of how you shuffle around the subjects at your A level, yeah,
It has to be that.
yeah, one those ones, yeah.
Okay. Have you experienced some challenges as
I can say the mentality of people around, because originally engineering has been a male-dominated field. So when they ask for someone to come and work on a device, and then they see a female, at first someone's first reaction is, will she manage or will she handle? But then that also gives you the strength to say, okay, I have a point to prove. Like, we're fighting all these stereotypes. With time they'll go, but so initially you have to be kind of, now we are trying to create that we can do what we say we can do, that we are equally able in a male-dominated field to achieve or to grow career-wise. Yeah.
did you see yourself
If you say childhood, no, not really. It was as a person who loved my science, yeah. So I actually saw myself going into medicine. That changed around my senior four, when I really turned out to love my mathematics as well. And so my mathematics and the biology and yeah, so I ended up doing math and physics and with biology. Yeah, and biomedical engineering actually was introduced when I was in my senior six. And because I told friends how I wanted that too, actually a colleague of mine called and told me, you know what, there's biomedical engineering here. And that's how I ended up there. Yeah.
all right, now any encouragement to the students?
I'd like to encourage the students that the field is open, the field is virgin. It's a very, very great field, I can say, from my experience so far. I've got the opportunity through this training, and even various people, the training has taken people to London for more training in medical devices, and also comparing health standards so that they can come and implement those here. So I've also, through biomedical engineering, I've also had a chance to travel and generally to improve the health of the people, like, because that's most satisfactory when the work you do greatly impacts the life of the people. If I work on a machine and it works well, and then my mom comes and she's treated, then I'm happy. But if she comes to the hospital and the device is not working, then I'm not happy. So the fact that my work greatly impacts life is a great motivation for me. And so for that reason, I also encourage students that it's not only medicine you can do that brings back people's lives. Sometimes people don't get these courses and they are discouraged. They want to, leave education. They don't get the traditional medicine, the pharmacy, but you can still impact life through other courses like biomedical engineering. Yeah, so you're welcome to the field.
Like she has mentioned, biomedical engineering is an area that has a lot of opportunities. I've come to learn that you get the opportunities that you create. So when you come with an open mind, when you know that you want to do a good thing through, eventually when you're done with school, you want to do a good thing, then you study hard, whether you're a girl, whether you're a boy, whether the mentality is that engineering is for boys, then come and set the pace like we're doing, yeah? And study hard, go through the challenges, and it will have so much opportunity, and you'll have the opportunity to make a difference, let me say, yeah.
Okay.
Yeah.
So are there more trainings, or would you like to have more trainings? Not just
Yes, I believe, like I think Dr. Robert mentioned earlier, that Ugandan Maternal Newborn Hub is just one of the very many capacity building projects, yeah. And so the hub also is organizes, such kind of trainings, but also these other different programs do organize training. So when you look out for them, sometimes they are called, they put, posters up and around, be it on notice boards. Let us also be a very alert people. When you want something, then you have to look out for those opportunities you want. So if there are trainings that you want, go to these websites, check them out. They're always there. She mentioned, traveling. It doesn't come by just waiting to be called upon to go and travel. You have to look for those opportunities and be, alert. Yeah.
Thank you so much.
Yeah.
Thank you, Sheila. Okay. That's it.
Thank you. My name is Arafat Wakulira. I'm a long-term volunteer. I've worked as a biomedical engineer in the UK for up to 10 years, and I recently came to Uganda as a volunteer for 1 good year to help build our community of biomedical engineering.
Okay. How was the experience like?
It is very interesting. We know education facilities are really developed in the UK. We know that also hospital services are really developed. They have challenges, and actually it was a great opportunity to have to go there, do my education and create a professional network of actually some really good professionals, doctors, professors, you name it, who I find out are very interested in Uganda. So most of them, now that I'm here, they're saying, Arafat, when can we come to actually be part of the great work you're doing?
What is that made?
So actually through a colleague, Dr. Sechitoleko, who you just talked to earlier, he came before me and we are great friends. We studied together. I know he was involved in this project from the beginning. So we've always been in touch, and I've seen the field really grow. Though in early stages, the rate at which our field is growing in Uganda is actually incredible. Compared to the UK, we know that they have an established or mature system. I guess compared to us, they still have their challenges, as you well know. But the rate at which the field is growing here is so steep. And it's great to be part of that development for sure. So there are many things going on. I can tell you about those if you're interested. But I for sure wanted to be involved as a Ugandan in the diaspora. So okay, we are in the UK contributing to the National Health Service, but as Ugandans, we have a big role to play in coming to really build our homeland.
Okay, how are people embracing it in Uganda as compared to this particular field?
Yeah. I think what I've noticed is people are taking it really, really well. And the project currently runs in 10 hospitals, and we are expanding partnerships as well. And every hospital we've been to, we've had the opportunity to speak to management, directors, patients, and even hospital staff who work there. They are all receiving this project really fantastically. They are saying that you are highlighting things we never knew, picking up the most simple things. I mean, you've heard from some of the upcoming biomedical engineers, those in hospitals, currently, and they have all received our presence in ways actually beyond what we imagined. What we are planning to do to take things forward is have a national conference of biomedical engineering, and we are even hoping to invite the president, the first lady, because she represents education, Minister of Education currently, so that they can help us to build the community of biomedical engineering. Several challenges, as you can imagine, and we want to engage policymakers, engage managers, professionals who are actually involved in doing the work to collectively really lift the community of biomedical engineering.
What has been your role in this area?
Yeah.
Volunteer.
So if I expand a little on my background, in the UK I worked as a quality manager. So I'm really fascinated by systems that work or processes that work. And in life you can almost break down anything into a process or a system. And I'm more interested in ones that really work. So my presence here is to see how we can adopt, take what's working well and scale it up. So if we know that you go to a hospital, you for instance find that an equipment has broken down, as a result they have to go to the neighboring hospital to process your results. That delays you, you might be in pain. So we want to see that we create a system where if such events arise, at least there is a backup, for example, to help manage the technology that ultimately leads to a treatment of a patient in a hospital. Okay. So I'm very passionate about such systems in our community.
Okay. How are such trainings going to impact on the health sector here in Uganda? How are they going to improve it?
For sure. The role of biomedical engineering is essential. It's actually an essential service in a hospital. Just to highlight one example, a surgeon, a doctor, however skilled they are, if they do not have a functioning medical device, they cannot carry out the procedure. And as you can imagine, the great team of engineers behind that are an essential part of the team. So at the moment, we are working really, really hard to be recognized in the community.
It's the biomedical engineers who come in and help out.
Indeed, we've come across many exciting cases for us where actually we are called in a theater. You can imagine a vulnerable patient is undergoing an operation, perhaps their chest is open. However, at that point in time, a device that is supporting their life has stopped working. And they would call an engineer then and then because they have knowledge of how to revive that medical device. They perform their intervention quick enough so that they can continue. So that's an example where the role of a biomedical engineer and technician in that team is so critical that it cannot be left out. So a lot of work is needed to recognize the cadre of biomedical engineering within every health institution, within this country. And there's great effort from all our colleagues to come together, to build associations, to write policies, to really make that possible. And I think our presence is to work with the great engineers who are already present and doing so much. It's unbelievable to see how we can really take it to that scale, to that level, across our whole great country.
Maybe a word to
I'd like to really thank the funders of this project who've continually supported us. The Uganda Maternal and Newborn Hub is the actual project, but behind it we have THET. THET stands for Tropical Health Education Trust, who have funded this project in its second phase. So they already funded the first phase. So they've ensured that we continue to do the great work we do. And of course, UK aid, because ultimately the money for this project comes from UK taxpayers. So we would like to acknowledge the great work they've done. And adding on to that, also in the UK, there is a Uganda Diaspora Health Foundation. So these are health Ugandans within the UK working so hard, just like I've done, to come and improve health here. So I would like to acknowledge them as well in the great work they are doing.
How best do you think these students here in Uganda?
Thank you for asking that, because the other aspect of our project actually is what we call Commonwealth Professional Fellowships. So we are able to actually apply for some funding to take some of the biomedical engineering professionals and students that are part of our project to the UK to actually observe how hospitals in the UK have in a way configured their systems and then bring that back to Uganda. So it's a great opportunity to know that students can be involved in that as part of their development, in terms of educational development, but most importantly for hospitals who are working to be involved in that. We've sent so many, we are continuing to apply for more funding to send more. So that's great opportunities for students. We are closely working with really all the education institutes within Uganda that are supporting biomedical engineering. We've heard of, we are being hosted by Chambogo University that has a long history of supporting biomedical engineering. They are the pioneers as well. They have actually collected this wealth of training equipment with their partners, the Amalthea Trust, and are supporting actually other projects to further build capacity. So we are working together here. So we are working with Chambogo. Makerere University is running a great biomedical engineering degree course for students. I can mention him. There is Ekure, of course, Mbarara University as well, is starting these projects. So there's no excuse to say, I cannot do this in Uganda, I should go to Kenya, South Africa. We do have what it takes to make this happen right here.
Okay, very encouraging. Thank you so much.
Thank you.